Good morning, everyone. Uh, Let us give a minute. Okay. Okay, I was just preparing this. Okay, so let's discuss. I will hand it over to Mahesh ji. Welcome, Mahesh ji. So today let's identify or do the case study on mouth ulcers from the lessons or chapters we have learned from chapter 1 to chapter 6. So we'll be using the knowledge we have learned so far till chapter 6. Like we have known about three doshas. We know about the rasas and the rasas related to doshas. We know sapta dhatus, and we also know the pancha mahabhuta related to doshas. We also know about dinacharya. We also know about ritacharya. We also know about a little bit about dravyas and food substances. With all this combined knowledge and how to do patient analysis or diagnosis, we actually learned. We'll try to put all our knowledge and we try to apply to this case study that is related to mouth ulcer, and we'll try to figure it out. So some of the things which I can identify, I'm trying to put it, and we'll try to update and we'll make a case study. So over to Mahesh.
Yeah, but mostly I will ask questions, so people will tell it. Okay.
Yes.
Yeah. So whenever a first, let's say the person comes and tells it's a mouth ulcer. So by the knowledge that you have, what do you say? You just jump on telling what to do, or what do you do? I'm asking question for everybody.
Asking.
I think first we need to understand the root cause, and the symptom is my mouth ulcer or the blisters on the tongue, right? So I think we need to understand the root cause, why it has come. How does that look like? Whether it is red color or white color?
You note this down, Rajaji. Color.
And where it has formed also, no, Mahesh ji?
This is mouth ulcer, so.
You mean to say, I mean, in the
in the sides and the top, like
yes,
that.
Yes, I have observed in
sides or in the edge of the mouth, or that is what you are asking.
Tongue, yes, I meant that.
Very valid question. Yeah,
correct. That's a good point.
I observed in my case, hence I know.
I'm not able to hear Raji. I don't know about others.
Now
I can hear.
I have observed in my case, hence I know.
Yeah. So sometimes even the ulcer will be on the gums also. That's a good point. I never.
Yes.
That's a good point. Then what else?
that's because of pitta dosha, no, Mahesh ji?
Yeah. So can you repeat?
It's because of pitta dosha, right? So
Yeah, that's
mouth
what.
ulcer
But we have to identify.
dosha.
We have to identify it's a pitta. That's the exercise that we will do today.
Okay.
So that's the exercise we are going to do. How to identify it? We want to pinpoint. Is it because of pitta dosha itself? We want to pinpoint.
Yeah, and I think a couple of other things.
Play a role?
Yeah, go ahead, Ragendra ji.
Sir, before that, like before we tell any remedy, first thing is that we need to know from how long it's there, and is there any like a food habit, if you are eating any food, or what is that food you had yesterday or like a couple of days back, which is causing that. So
exactly.
It's not only like, yeah, and what is like when it is like what season it's coming? Is it coming first time? Yeah, is it coming first time, or is it like already like every season they are getting, or is there any food habit, or is there any pattern you are getting? And like one more thing is that
slowly, Raghavendra ji, I know that you will lose the flow, but a little bit slow, so that our Rajji will write it down in points, so it will be helpful for others. So
okay.
My I made a.
Yeah, we can
I am already made.
mention frequency of occurrence.
Oh, he made already a points. Okay.
Few points I already made. I'm going to add, which is I think missing. Like you
It's
know.
not missing.
See,
So
I made like a 3-step diagnosis of a patient. So since mouth ulcers, people can identify. What about if there is another disease? How do you try to identify? That's the question that comes. So what the recommends in Ayurveda is 3 steps. That is darshana, sparshana, and prashna. Darshana means when patient comes and he's going to tell about the disease, you need to find what is the disease, where is the location, like Suchitra ji or Sharnaji said, in the tongue's location or side of a mouth where, and like color red and white. So you can ask the patient to touch himself and see, or if there is any utility you can use and verify it. Okay, that is Darshana, Sparshana. And Prashna will be like, like what Raghavendra ji see, from what find.
So there was Prashna, you write it down for this case study for a mouth ulcer.
Yes.
So what Raghavendra ji told very good points. So those you noted down. One point was like when it started and before that, what did you eat? So
yeah, what kind of food patients had I written?
Yeah, just before starting, what did you eat? So that's the question. And also we can ask, what is your diet? Like what is the diet? What is the age?
I written that next. Now, once after these 3 questions, identify the patients. Like correct. What is the current season? What is the patient's age? Like is in a like is it like early young age or kids like 15 years, middle age 15 to this one or old age? Season I have mentioned. Then I mentioned also see dosha of a body.
So that will go later. That will go later.
Okay.
Go ahead, Raghavendra ji. You have more points.
Apart from that, like we will ask, is it like a family heredity? Sometimes it will be their family heredity also, or is it general thing? Then we will be seeing that as a.
In this case, one good thing is related to what you told is only you have a mouth ulcer in your body right now, or any of your family members also has it. That's a good question to ask for mouth ulcer. But for the diabetes and other kind of things in hereditary we can do. For mouth ulcer.
Maheshji, one more thing, oral health also add to this. I have observed. I don't know.
Correct. We can ask what is the things you do for oral health? Only do you use toothpaste only or anything else? Yeah, that's a good question to ask.
Sir, will digestion also matter?
Can you repeat?
Sir, will digestion also matter?
Digestion, yes, it does, because if you want to identify, see, we pinpoint. If you want to pinpoint, it's pitta. We can ask, how is your hunger? Like you feel a lot of hunger or very hunger. Another question is, you can ask acidity. Do you have acidity or not? Yes. And whatever. First, we need to listen to patient. Everything we listen, and then we ask more questions. So let's say in our case, in this case, we start with questions because we don't have a patient. So we ask many questions. So right now, do you have acidity is one of the questions.
Sir, one more thing. Many a times people will have ulcers because of wrong biting. And sudden hal kachkondu ago taraddu ulcers.
Correct. So that's why we asked, what did you eat? And then anybody else in your family has it. If it is due to, like, for example, there is small chili, right? So that's very spicy. So if you have, sometimes 2-3 people will have also mouth ulcer. So that kind of thing also is there. And in this case, we can ask, do you eat sweet at all? Do you eat sweet, or no? You never eat sweet, like that.
Sir, is it with sugar or with jaggery? That is one more question you need to. No, because with sugar it causes a lot of acidity. That's why.
True. So one good question to ask is, do you have acidity? So that's a good question to ask.
And if there is an acidity in the, it is related to vata kind of, sir.
Acidity is mostly pitta, but we'll see. I will tell you, it's very easy. See, let me tell you, Ayurveda is very, very easy. Okay, so very, very easy, but still it is difficult. How it is easy, how it is difficult, I'll tell you.
And the duration also, no? How long it lasts? We can ask that one.
So yeah, correct. So this is a mouth ulcer is repetitive, or this is the first time you got? We can ask that question, Rajuji.
And sir, I'm not sure whether we can ask this question or not. So we can ask like, is there anything if you're eating, it will aggregate, or is there anything which you're eating?
We should ask. We should ask.
Yeah.
We should ask. Mostly people, Indian people, will stop eating spicy food as soon as they get mouth ulcer because they have inherent knowledge. See this Ayurveda, but they are losing it. The young generation are losing it. They eat whatever they want, even though they have some problems.
Sir, yesterday I was thinking about this.
Yes.
I was just thinking about this. All my grandfathers, even though they were illiterates, they were telling this is Shita, this is Ushna, you should not eat this.
No,
and
no,
that
I'm sorry, they are not illiterate.
No. I mean, yeah. ಅಂದ್ರೆ ಶಾಲೆಗೆ ಹೋಗಿ ಓದ್ ಕಲ್ತಿಲ್ಲ ಬಟ್ ಜೀವನ ನಡ್ಸೋ ಜ್ಞಾನ ತುಂಬಾ ಚೆನ್ನಾಗಿತ್ತು ಸರ್ ಅವ್ರಿಗೆ. ಅದನ್ನ ನಮ್ ತಂದೆ ತಾಯಿಗಳು ಸ್ವಲ್ಪ ಕಮ್ಮಿ ತಿಳ್ಕೊಂಡಿದ್ದಾರೆ and they don't know the reason why. So now we are in the state like we are asking why we should do it. So it's time that we should know the right reason and we should tell that to our children.
Exactly, correct. That's true.
ಮ್ಯಾಮ್ ಒಂದು ಸಣ್ಣ ಕರೆಕ್ಷನ್ ಇಲ್ಲಿ ಏನು ಅಂತಂದ್ರೆ ಇವತ್ತು ಯಾರನ್ನು ಹಳ್ಳಿ ಕಡೆ ಹೋದ್ರೆ ಖಂಡಿತ ಅವ್ರಿಗೆಲ್ಲ ಗೊತ್ತು ಮ್ಯಾಮ್. ನಾವು ನಮ್ಮ ರೂಟ್ ನ ಮರೀತಾ ಇದೀವಿ. ನೀವ್ ಇಲ್ಲಿ ಪೇಟೆ ಜೀವನ ಅಂದ್ಬಿಟ್ಟು ನಾವೆಲ್ಲ ಇಲ್ಲಿ ಮಾಡ್ರನ್ ಅಂತ ಇದ್ ಮಾಡ್ತಾ ಇದೀವಿ. ಅಷ್ಟ್ ಬಿಟ್ರೆ ಹಳ್ಳಿ ಕಡೆ ಇವತ್ತು ಹೋಗಿ ಇಲ್ಲ, ನೀವ್ ಇವತ್ತು ಹೋದ್ರು ಹಳ್ಳಿ ಒಬ್ಬ ಚಿಕ್ಕ ಹುಡುಗನ್ ಕೇಳಿದ್ರು ಪಪ್ಪಾಯ ಜಾಸ್ತಿ ಉಷ್ಣ ಆಗತ್ತೆ, ಆಮೇಲೆ ತಿರ್ಗಾ ತಿಂದ್ರೆ ನೆಗಡಿ ಆಗತ್ತೆ, ಅವ್ರಿಗೆಲ್ಲ ಇವತ್ತು ಗೊತ್ತಿದೆ ಮ್ಯಾಮ್. ಆದ್ರೆ ನಾವು
ಅದು ತುಂಬಾ ರಿಮೋಟ್ ಪ್ಲೇಸಸ್ ಅಲ್ಲಿ ಇರ್ಬೋದು, ಬಟ್ ದ ಪ್ಲೇಸಸ್ ವೇರ್ ಐ ಗೋ ಲೈಕ್ ರಾಮನಗರದಲ್ಲಿ ಒಂದ್ ಹಳ್ಳಿಗೆ ಹೋದ್ರೆ ಮನೆ ಕೆಲಸ ಮಾಡಲ್ಲ ಹೆಂಗಸರು, ವಾಷಿಂಗ್ ಮಿಷಿನ್ ಇಟ್ಟಿರ್ತಾರೆ. ಅಂಡ್ ದಟ್ ಇಸ್ ಸೋ ಪ್ಯಾಥೆಟಿಕ್ ಸರ್, ದೇ ಡೋಂಟ್ ವರ್ಕ್ ಇನ್ ದ farms, they'll go for evening walk wearing shoes, you know.
Correct.
So this is the latest change what it has happened.
So one thing, let's keep one meeting only for this kind of discussion. Actually, I need to leave by 7 o'clock. We have 15 more minutes.
Okay.
I'm sorry. So,
that's okay.
So now, what are the questions we can ask?
Duration we can ask, no?
We did. That's completed. Anything else?
I will ask probably how is your bowel movement? Are you finding difficulty?
Yes. So there are three basic questions we need to ask. Okay. So one is, do you have ulcer? Whenever we see ulcer, we need to ask: is there a bleeding? Is there a bleeding, or is it white color or red color? So white, usually the bleeding is with red color. Okay. Is there a bleeding? That's a good question to ask. Okay. And we need to ask pain. Like, is there a pain, or only when you eat spicy food there is a pain? So by this, you write it down. There is a pain or not.
And the food if touches that area, no, it irritates more.
Yeah, that is normal. That is normal. That is normal. There is a pain or not, and then
ಸರ್ ಅಕಸ್ಮಾತ್ ಅವ್ರಿಗೆ ನೋವು ಬರ್ಲಿಲ್ಲ ಅಂದ್ರೆ ಖಂಡಿತ ನಮ್ ಜನ ಇದು ಏನು ಪ್ರಿಕಾಷನ್ ತಗೊಳ್ಳೋದೇ ಇಲ್ಲ. ತಾನೇ ಅಷ್ಟೇ ತಾನೇ ಏನಾಗಲ್ಲ ಅಂತ. ಯಾವಾಗ ಅವರು ನಮ್ಮ ಹತ್ರ ಬರ್ತಾರೆ ಅಂದ್ರೆ ನೋವಿದ್ದಾಗ ಮಾತ್ರ ಬರ್ತಾರೆ. ಕರೆಕ್ಟ್ ಮೀ ಇಫ್ ಐ ಆಮ್ ರಾಂಗ್.
Yes, that is true also. And sometimes people, like I have observed, like even one pimple, they send photo, sir, this pimple I have got, my kid has got this pimple. So people are very sukshma. There are people who are very sukshma, and people are very ignorant also. Like whenever they face the final problem only, they will come. And we don't want this also. Don't want this also. We want something in middle. Who take precautions, who doesn't worry for very small things, but who is brave enough and who can handle things. So that's what we are looking for. So then we can ask, is there anything which is oozing out of the wound, like any watery stuff is coming out or not? That's a good question to ask. I'll tell you why. So that can you note it down, this one?
Which might be?
Any stuff is coming out of the ulcer. Like
Oozing out.
any watery stuff or anything, it is coming out of the ulcer.
Bleeding, I mentioned.
Bleeding is
it's not
blood.
bleeding. It's not blood.
Oozing,
It is
oozing.
pus or something.
Correct.
Pus or
It's
watery
any
stuff.
discharge.
Yeah.
Some watery
Discharge.
stuff. Correct. Some discharge kind of thing. So I will tell you, no, we need separate, bleeding separate, pus and liquid separate. I'll tell you why. I will, today I will show you the very easy method how people, why they ask so many questions. So why when you go to the doctor or Vaidya, sorry, when you go to Vaidya, doctor, they don't ask any questions. But when you go to Vaidya, so why they ask so many questions, I'll tell you. Basic questions they will ask for everybody. But so we need separate line for the discharge from the wound and the bleeding from the wound. Okay. Any other questions we can ask?
Since how many days or something?
That's done.
Should we also relate to whether your eyes are burning?
Yes. If there is a burning sensation anywhere in the body, we can ask. We should ask that question.
I put burning sensation.
Anywhere in the body. Then any other?
And we can ask, how many days are you taking oil bath? Do you have a habit of taking oil bath entire body?
That is lifestyle. We can keep that question. But yeah, we can keep that question. No problem. Any other?
I think we have pretty much covered the related questions, I guess.
We need to ask. We ask a lot of pitta related questions. For sure, we can see. We asked 1 or 2 questions about vata. We asked 1 question about kapha here, kapha for this one. Okay. So basically, we need to ask questions related to vata. We know what is the quality of vata, dryness. Then about kosta, we did ask, right? And then burning sensation, which is related to pitta, and any discharge, pus or anything that is related to kapha. So then similarly, no, yeah, correct. So if the answer is yes, then kapha. So we write vata, pitta, kapha for each of the answer. So let's write it down.
Okay. What kind of how long or how many days this mouth ulcer is having issue? This is just for reference. We can't write for that.
Yeah.
Correct. What kind of food patients had
for
from
each symptom? For each symptom, we write vata, pitta, kapha.
Yeah. What kind of food patients had from past couple of days?
Yeah. So for that, we need to assume things. For example, he did spicy food. It's right, pitta. Huh? He took some dry food like aloo, a cabbage. Then it's vata. Then then he ate some oily food. It is kapha. So one assumption is with kapha mouth ulcer will not come, but only kapha will mouth ulcer will not come. But there is a pitta plus kapha which is very rare, but it will come.
And one more thing I have observed in my case, Maheshji, dental procedures after undergoing that.
Oh
no?
yeah, that one
Yes.
one thing we forgot. Any medication you are taking currently? So that is one good question. Thank you.
Sir, before
Suchitra ji.
medication, the spot where they give the injection that gets ತುಂಬಾ ದೊಡ್ಡ ಗಾಯ ಆಗ್ಬಿಡುತ್ತೆ.
Oh, okay. Any medications and you had any procedure?
Yes, dental usually.
Yeah.
Dental procedure. Dental procedure is total nonsense. We should never go for dental procedure, but that's another topic. Yeah, let's write fast, little bit faster, Rajiji, please.
Yes.
So we are making a note. Each one of us are making a note. You can just continue, sir. Later we can update in the Excel.
So each of the symptoms we make pitta, kapha, or vata. For each pitta, we'll write 1 point. For each kapha, we'll write 1 point. And each vata related, we write 1 point. whichever high we get, that is the dosha we have. So let's say we get 3 pitta, 2 vata, 1 kapha, so it is pitta problem. Okay, and sometimes we get equal, so that is we will have pitta and kapha both. That's why the more questions, the more detail you can answer. The more questions you ask, we can identify, is it pitta, is it vata, or is it kapha. So the more questions you ask, basically the question should be determinant. That means we can identify this symptom is pitta, we identify this symptom is vata. So that kind of questions you need to ask. So somebody, I think everybody except Raju ji, I don't know about Raghavendra ji, other people have taken some or the other remedies from me. So you know what kind of questions I ask. Lot of questions I ask. So those questions will help me to identify, is it pitta, is it vata, is it kapha. In this case, so all we see 3 pitta, 1 vata, and 1 kapha. Okay. So this is pitta related. We can conclude this is pitta related to make it quicker. Okay. And then now let's go to what we need to do, remedy. So identification is the most, 90% is identification. Only 5% is remedy, you know, and 5% is some psychological thing that we need to tell. 90% is identification. Okay. 5% is just remedy, because there are thousands of things we can do for this. For very easy things we can do. We can just tell them to stop some things, the mouth ulcer will go away. So let's go to what we can do right now. Okay. So what we can do? Anybody with so let's take rasa only for now. So what rasa you should take? What rasa you should stop?
Madhura rasa should be added.
Madhura rasa
Snigdha
we should take. Yeah.
and a little bit of bitter, tikta.
Yeah. So add that.
Lavana rasa
Lavana
we should
be
stop.
Should be avoided.
Yeah, it should be a stop.
Madhura, amla and tikta should be taken. Yeah.
No, amla should not be taken, sir.
Amla gotilla.
Yeah, amla no.
is acidic.
Yeah, amla no. So
Yeah.
Madhura is for sure.
Madhura,
Madhura, tikta, and
Kashaya.
sneha.
No, kashaya.
Madhura and kashaya rasa we should take, and no other guarantee stop is spicy. That is tikta, spicy, and
Tikta katu.
katu. So katu and salty. Katu and
Tikta, lavana and katu stop. Tikta, katu and lavana.
Yeah, write it down. Madhura and kashaya. Now Madhura and kashaya, best what is the best thing, Madhura?
Sweets.
Honey is best actually.
No,
Honey is not the remedy for this.
Honey is the best remedy for this.
Oh.
Honey, just you can do gandusha or kaval. Kaval of honey, just one time it will go away.
Oh.
Just keep 1 spoon of honey in the mouth for 3 minutes, it will go away within 1 day.
how about ghee?
Ghee also, yes, ghee also very good. So we'll come to virya. First we'll talk about rasa now.
Okay.
So in the rasa only, we identified if you take madhura rasa or kashaya rasa
Tikta.
or banana. Banana is a good one. I am surprised nobody said banana. So banana has kashaya as well as the madhura rasa both together. And so which are dravya you read? Dravya, you have read amla. You have read harade, I think. Haritaki you have read.
Yes, sir. Yes, sir.
Yes. So among these herbs, which one have you suggest here?
I think
haritaki and honey.
Yeah, haritaki you can use, but haritaki has some ushna virya. So vibhitaki also we can use. Vibhitaki is very good because it is also ushna virya. So one thing is ushna virya. This is ushna virya. So when to use
amla and honey.
Yes, amla and honey is the best thing.
Yeah, amla is
so haritaki is ushna virya. Haritaki and Vibhitaki is Ushnavirya. But mouth ulcer, sometimes it is associated with some this what is it called? There is one good word for in Sanskrit. Bacteria. Oh, bacteria. So in that case, if you have bacteria and stuff like a fungal related in mouth, they are getting fungal plus the ulcer, then Bibhitaki is very good.
So usually, like we ask, I don't know whether it's right or wrong. We ask to drink them buttermilk, or if not, curd with sugar or sugar especially.
Curd with jaggery or sugar, yes. And one more thing, rock candy sugar. If you get a best rock candy sugar, that's also very good. So as I told you, there are thousands of things, thousands of remedies. Identifying is the first thing. Once you identify, easily you can do. Very easy. Even everybody can do it. See, now only we got maybe 10 remedies.
Sir, and Gulkan is also good.
Yeah, rose petals. Even if you don't get Gulkan also, only rose petals you can use. So one Gulkan also is originally made from honey. So that's the original Gulkan. But now they are making from something else, but that's okay.
So in that case, Gulkan should not be mixed with hot milk, alwa, sir, if it is made from honey andre.
No, we should not do. Who will mix Gulkan with milk? I don't think anybody will mix.
No, we will have it just like that.
I taste it.
Yeah, I don't know hot milk. Who will mix Gulkan with hot milk?
It's like a jam. You can just
like jam.
have it
People
like
will eat with some bread or some other things. Chapati.
It's Gulkand, KND. So Kand, you know, Desi Khand, like that Khand, but it became like So,
BHI, Rajuji, BHI.
Vibhitaki. Now, Vibhitaki is the
VIG.
best herb. Vibhitaki is the best herb when there is associated with
some bacterial infection.
From bacterial infection. 1 minute, I'll tell you what is the name for that, so you can remember also.
Fungus infection.
No. I'm telling about when you read the books. So
Sir,
you will
Vranavantana.
No, well, give me 1 minute. I'll just give me 1 minute. Krimi. When you have krimi, okay.
It is intestinal worms, sir.
Krimi is any worms. Krimi means krimi means not only worms actually. Krimi means bacteria. Krimi means viral. Krimi is when you see krimi in our text, Ayurveda text, it is you can assume it is only not only worms. So Vibhitaki is very effective in krimi.
Okay. No, because in English version they have given only as intestinal worms for krimi. That's why. Now,
when you read more books Ayurveda, you will understand. No problem. But krimi is bacteria. Krimi is virus. Krimi is worms. Everything.
And I think, sir, like, sorry to interrupt you. I think 2 questions we need to ask. One is like, how many hours he sleep, and second thing is the nature of his work also. Correct me if I'm wrong.
That is the remedy. You are telling correctly. So that is a remedy. Now we have pitta, right? So pitta people always don't sleep properly. So they are always passionate. They want to do something. Always they will be awake till 2 o'clock, 3 o'clock. So we need to remedies. We need to tell them. Like psychological, I told you, right? So you need to tell them, see, if you don't sleep properly, you might get this repetitive. We should tell them. Yeah. So lifestyle is sleep properly because we identified it's a pitta right now, right? We concluded it's pitta. So pitta in lifestyle, what are the things that will help in pitta? Coconut oil gandusha, then sleep, good sleep. It will increase kapha and it will reduce pitta, and it will reduce vata also. Good sleep. And what else? Other thing you told, Raghavendraji?
Buttermilk and Akani sugar, rose petals, and about tender coconut. Drinking tender coconut will it not?
Tender coconut, so little bit confusion will be there. So tender coconut, it has kashaya taste. So tender coconut, each stage of tender coconut has different taste. For example, very young, which doesn't have coconut, which doesn't have the layer in it, it is kashaya taste. Okay, so that is very good. Actually, one of the remedies, you just take out the when they're splitting the coconut, you get a layer of after you take it out, there is a layer inside, not the coconut, but the skin itself. There is a layer that you eat. This will go away. This will go away. The mouth ulcer. It's very kashaya taste.
Telu ganji.
No, that's not ganji. There is no ganji at all. The ganji itself is not formed. It's very, very young.
Okay.
So in this case, that skin itself, inside skin, that white color, not white color actually, it is creamish color. That skin itself, you just take it out with the spoon and eat it. It's very kashaya taste. So that is another one.
Yeah, but usually like the tender coconut, right? We will use with what do you call in Kannada now kalsakre ಅಂತ ಹೇಳ್ತೀವಿ. So that with that, tender coconut is actually candy sugar. But actually, like tender coconut is like vata. But when you're adding candy sugar, then it will become samasitoshna.
So that's what I was telling about tender coconut. Tender coconut is very tricky. When it's very, very young, that means even the white color is not formed. That is kashaya taste. Okay. When there is a ganji, that is sweet taste and it will reduce pitta. And when it is full, it actually increases pitta. When it is fully grown, that fully grown coconut, it will increase pitta. So tender coconut is they are very tricky. So it's better to not tell about coconut, but you can always tell that dry coconut, chew dry coconut and gasagase. That is another remedy here. This one.
Yeah, dry coconut and
gasagase. Kaskas.
Correct.
Couscous.
Actually, they tell kaskase, ಮತ್ತೆ kalsakre, ಮತ್ತೆ ಒಣಕೊಬ್ಬರಿ, sir.
Yes.
Couscous.
Rock candy sugar.
Yes. Couscous.
Yeah, rock candy. See, now.
No, it's poppy, I think.
Now all these things we are getting because we identified. You saw what is the 90% is identification. Once we identify, we can just suggest. Let's say now we got 2 points of vata and 3 points of kapha, 3 points of pitta. Then in that case, we need to tell them any herb or any remedy which help in vata also a little bit. So see, usually we suggest remedy for one, but they come back and tell me, Mahesh ji, very thank you, or Sharanya ji, very thank you, or Chaitra ji, very thank you, that you suggested, but all these problems also gone, other problems.
Okay.
So that's the
beauty of Ayurveda. Yes, exactly, sir.
So we need to suggest any remedy which actually, so in this case, we have 3 pitta, 2 vata, and 1 kapha, right? Go up. So 1 vata, 1 pitta. So in this case, totally pitta. So let's say you ask more questions and you get some vata, or that person mentions, he or she mentions some other problem related to vata, pain or something, right? Dry skin or hair fall, something. Then you suggest something, coconut oil is best, right? Coconut oil, gandusha. That case, they come back and tell, oh, this also is reduced, like that. So now you understood very easy way of how to identify. So once we identify it's a pitta, so many remedies. We only give at least 20 remedies now. The remedies
So
is
I
very
have
easy.
another question here. So we will give according to the all our investigations. So maybe we will give the right thing and it will go away. And why does that reoccur again? What is the reason and the root cause for reoccurrence?
Yeah,
again you would have eaten spicy food.
No, with the
ಅದು ಧಾತುನಲ್ಲಿರುವಂತ ಪಿತ್ತದಿಂದ ಮತ್ತೆ ಅಗ್ರಿವೇಟ್ ಆಗುತ್ತೆ ಅನ್ಸುತ್ತೆ.
No, we can ask question. We need to suggest lifestyle also. Only remedies. Remedy is first part. Second part is lifestyle. We need to tell them, okay, so you have burning sensation or something, all right, or you have eaten spicy food, so you are very thin, and you always get piles or whatever you ask the questions, or he will tell. Based on that, you will understand he is Pitta. Then you will tell. So these are the things if you want to continue a good lifestyle, you need to sleep properly. If you don't sleep properly, you get repeated. That I told you one thing. So like that, you need to tell them. So you need to use this daily. If you use this Triphala as a tooth powder, or which has Amla as a tooth powder, no need to take medicine only. Just stop toothpaste and use the tooth powder which has Amla, right? So like that, if you tell, it's called Yukti. Yukti is it will come little bit later, but I am just telling you. So it's a Yukti means intelligence. So or ideas basically. Yukti means ideas.
Can we add one, sir? Sorry to interrupt. Can we add one thing here, like which when we are telling to any patient or like any of our friends or relatives or like whoever, when we are balancing everything, automatically it will not reoccur. So we need to make sure everything is balanced.
That they will not understand, Jay. That's why they are coming to you. That they will not understand.
Sir, because in case if they don't want it to reoccur, then we can say that, which in layman language.
Or we can give some tips. So whenever you eat spicy food, you take kalsakre. Or whenever you eat some very salty food, first of all, salty food is dangerous than spicy food. So you need to tell them salt, definitely you need to avoid. But let's say they take salt only. Then that day you take haritaki powder. Like that you need to mention. So if you do this, it will not reoccur like that. And also we need to make them aware, like this is the first stage. If you continue like this, what are the other problems you may face? Like the mouth ulcer can become piles, right? The mouth ulcer become very chronic acidity, and nasal bleeding